I'm Dr. Lindsay and I'm here at Optimal today talking with the team from LightHouse Arabia, and so we're going to be talking a little bit today about how we can use goal setting to help us with our mental well-being. So to start off with, shall we all introduce ourselves? I'm Dr. Lindsay, the family medicine consultant here at Optimal.
My name's Dr. Robert Chandler. I'm a clinical psychologist and also the managing director of the LightHouse Arabia.
I'm Stephen Jordan. I'm one of the personal trainers here at Optimal Fitness.
Hi, I'm Rebecca Carter and I'm a counsellor and somatic and trauma-informed yoga teacher at the LightHouse Arabia.
As I mentioned, we're going to be talking a little bit about goal setting. So maybe first of all, Dr. Robert, you could help us understand about the role that goal setting can have in helping us establish our kind of emotional strength and resilience.
Yeah, so I mean, the first thing to say is that there's a direct correlation between our ability to set goals and also accomplish them to some degree, and I'm going to come back to that point because accomplishing to some degree is important and nuanced. There's a correlation between that and also our overall emotional well-being, okay? So people who are generally better able to set goals and to follow through to some extent consistently generally have higher levels of emotional resilience, generally better at managing difficult days when emotions come and go, okay? Now, with correlations, of course, it's a sort of, we can't infer causation necessarily, okay? So which causes which, but we do know that the two very heavily correlate. And if we think about our two most prevalent mental health conditions, so depression and anxiety, it makes sense that goal setting is in some ways the antidote or the anti-venom of anxiety and depression. Why? Because with anxiety, people are often very fearful, and at the root of anxiety is this idea of uncertainty, okay? And when we are able to commit to goals, to get into habits, to get into routines, that brings us a level of safety, predictability, control, if you like. And similarly with depression, one of the core features of depression is a sense of failure or hopelessness or just not feeling like I'm on top of stuff. And when we are goal setting and following through, that is giving us a sense of mastery. And what we know is that as human beings, we're both very complex, but we're also incredibly simple creatures. And if we have a degree of mastery over the things that we're doing, this is good for our mental health and well-being.
Yeah, absolutely. Rebecca, have you seen this in clinical practice, how this can have such a positive effect?
Yeah, I think it's one of the foundations of therapeutic work, and similar to what Dr. Roberts said, it gives clients structure, meaning and purpose, and I think it meets a deep psychological need in order to have a sense of certainty in life and to be able to work towards aspects that feel meaningful and give you purpose. And a lot of the time it helps clients feel a sense of accountability, and that enables them to build self-confidence. And so you can also use it as a way to measure progress, which I think clients like. It's a nice way, to be able to track back and say, where are we now? Where did we start? Where are we now? And what's the journey been like? And I always invite clients to think about goals as something that we work towards, but it's not about necessarily the finished product, it's about the process, the journey. And I think that clients connect a lot in this process of self-discovery, and a lot of the meaning making is actually the process of setting goals. And that's, I find, what gives people the confidence, the inner resilience, the strength. But similar to what Dr. Roberts said, it does really support with quite prevalent mental health conditions like anxiety and depression, because it helps clients connect meaning, certainty, purpose, structure, control. It's a really important aspect of it.
Yeah, absolutely. And obviously a lot of people, one of the ways in which they help maintain their mental well-being is through fitness. And Steve, do you find that there's a big impact of having goal setting within a kind of an approach to fitness?
Yes, absolutely. I mean, as the Lighthouse team have already alluded to, goal setting is super important for setting up that structure. So one of the first things I do with clients is establish exactly what it is they're trying to achieve. Knowing that allows us to build this structure around their training so that both they and I know exactly what we're working towards. It just sets up that pathway, and them actually being able to take sort of accountability for what they're trying to achieve in the gym, rather than just coming in, moving around, lifting some weights, that sort of thing, and then going home. It actually gives them that sort of framework that they need to guide their training. It gives them that accountability. So every session they come in, we know exactly what we're going to do, and goals always change. I mean, most people that come in initially, they all have the same goal: I want to be fitter, which in itself doesn't mean anything. But the first part we need to do is trying to narrow that down to exactly what does that mean? What are they trying to achieve? And then we start our journey, and then before you know it, a couple of weeks down the line, it's like, well, actually, you know what? I've had to think about it, and I've changed what I actually want to do, and it just kind of becomes more and more specific and more tailored to them as it goes along.
And if I could just jump in there as well, I think what I hear from both of these guys is the word that keeps coming to mind is direction, right? And whether it is in the gym, whether it is in therapy, whether it is in healthcare settings, actually, Dr. Lindsay, people need to know and want to know where they are going. Now, as you say, that can change along the course of treatment or intervention, but people generally like to know where they're going, and that is what goal setting provides, a direction. And we find in the therapeutic space, if you have an agreement with a client about what we're going to be doing and where we're going, those two things really predict positive outcomes. And I guess the same for both of you, as you know, yeah.
Yeah, I mean, I completely agree. And I think one of the things that's quite important is that when we're thinking about setting goals is about making goals which are suited, correct for the individual. And when we're thinking about that, quite often identity comes into this. How, when in your kind of therapeutic setting, how does that play a role when thinking about how to move forward with therapy?
Yeah, so I think sometimes, and I'm just going to break this down a bit, because I think there's a lot of research around the benefits of understanding what our values are and trying to set goals that are aligned with our values. And I think there's been a real movement over the last decade and a half to say goals should only be aligned with your values. And I would say, because what we've actually done as a profession is said you should never experience any shame, you should never compare yourself to other people, it should all be intrinsic and come within. And I kind of, maybe this is slightly controversial, but I want to bust the myth. Healthy levels of accountability are good for us. If I've set myself a particular goal and I'm looking in front of the mirror and I'm saying to myself, actually, Robbie, you know, you've let yourself down here a little bit, that is okay. So I would say not all goals necessarily need to be completely aligned with our values. A bit of healthy shame, a bit of healthy comparison is okay. But there's that phrase, right? It's the dose that makes the poison. So if we are going super hard on ourselves, super harsh critic, this is when we can find ourselves in the territory of mental health struggles and not achieving our goals, because we're just like, what's the point, right? So if we, going back to your original question, if we can align ourselves with our values, so if I value connection with others, if I value nature, if I value health and fitness, I'm then thinking to myself, right, these are the characteristics that make up who I am and who I want to be. Let me set some goals around engaging in a behavior that is aligned with those values. So I don't know, hiking through the mountains would tick the box for all of those three. I'm more likely to follow through with the goals because it's aligned with my values. And I've met people before, you know, who don't value going to the gym in the slightest. And what happens? They typically fall out quite quickly. So choose something that aligns, if we were really going to boil it down, something you enjoy, right? Something that provides you with a sense of fulfillment. So yeah.
I completely agree. I say this a lot to patients. I'd rather them make small changes, which are lifelong, than huge changes that are going to last 3 months. In terms of talking about whole life wellness and longevity, it has so much more value to it. But I think that could be quite a hard mindset when you're so motivated and it kind of in that moment. Steve, when you have clients who kind of come in all guns blazing, and then that motivation starts to fall, how do you approach that?
I mean, motivation comes and goes, as you already said. It comes and goes. I mean, New Year's, great example. Everyone's like, right, new year, new me, that sort of thing. And they like to go into the gym, they smash it for a month, they smash themselves up for a month, and then by February they've burnt out and they'll never go to the gym again, you know, that sort of thing. And again, this is where goal setting becomes super important. Okay, when you set goals, they need to be specific to what you're trying to achieve, and they need to be achievable. you have to set achievable goals. So one sort of shortcut I use when it comes to setting goals with clients is I set small goals to be achieved throughout the year. We obviously have our big overarching goal over here. It's like, okay, right, we're going to work towards that across 6 months, a year, or however long it will realistically take to get there. But then we have all these little stepping stones. So, okay, so maybe, by the end of the month, I want you to be this level of active. I know you want to be doing 6,000 steps a day, as an example. And then when we get to there, we look back and we say, oh, look, you're doing 6,000 steps a day. That gives them that little boost of, oh, I've achieved this, I feel good, and it sort of builds on that motivation as well at the same time. But if a client gets to a sort of roadblock, and it always happens, things come up in life. You get busy, the kids get sick, whatever, these sort of things, you start to miss workouts or whatever it is. You're not hitting your targets that we've set. It's always a case of just sitting down, having that conversation and saying, right, let's bring it all back. Let's have a look at our big overarching goal and let's just try and remember why we want to achieve this, what initially pushed us to start taking on this journey. And 9 times out of 10, that's enough for them to think, okay, right, it's fine, I've got this, I can get back on the horse and start working towards this goal again. Because everyone, based on their value system, they have their own reasons for wanting to come to the gym specifically or other things. And it's just about remembering why you started and why you need to keep going, for whatever reason. So just bring them back into that, try and bring them back into that mindset. It just helps to push them along until the motivation levels come back up again naturally anyway. Yeah.
I think it's moving almost back a step from there. Rebecca, I was just wondering, often when we're struggling with our mental health, motivation is a massive issue, and I often get patients who come and see me and we're talking for the first time about their mental well-being, and they just say, I can't even get myself to go to the gym or go to therapy. And there's quite often that's a huge barrier to progress. What tips might you have for individuals at the moment who are struggling and who know that that's what they want their long-term goal to be, is to maybe go down a therapeutic process? What tips could you give those individuals to help them at this point?
I think most importantly, you have to connect with your why, and your why might look different at different stages of your journey, but if your why for getting out of bed, for going to therapy is enough, if it motivates you enough, if it connects with you enough, then I think that that's a starting point. And to take bite-sized chunks, so really look at ways in which you can start small and gradually increase and get bigger and expand it, because the good thing about setting bite-sized chunks is that you see more immediate reward and action, and that naturally empowers you and builds confidence. So I think most importantly, when I work with clients, I really want them to connect to their why, because you'll see on social media, everyone tells you to go to the gym, to go on this diet, to practice yoga, but until you have your reason, and often that reason is a source of pain, it could be a source of tension in your life, which I think, what Robert was saying around, it's not unhealthy to experience certain levels of shame or discomfort. That's often the driving force. So if we can alchemize that into energy, into sort of action, and also I think to really help people connect with the fact that they are not their behaviors. Yes, their behaviors reflect important aspects to them, but it's more about the qualities that your goal brings to you. So we talk a lot about identity-based change, where it's connecting with who am I rather than what do I want. And if you focus on who you are and what qualities you want to work towards, often you'll create goals that align with that, and naturally that they're skills that are transferable. So if you go to the gym and you notice that a goal is being achieved in that way, you can normally transfer it to work, to friendship, to other aspects of your life as well. And it helps you align in all aspects of your life, mentally, physically, spiritually. Am I creating goals that feel right for me? And what is my reason for doing this? I think that's a number one source of motivation for sure.
Yeah, I think.
Yeah, and just to sort of tail on from that, again, I mean, you've both said it. It's so important to realize that you don't have to succeed at everything. You don't have to be the best. I think there's just so much pressure put on people. I mean, just talking from the fitness side of things, the Instagram and these sorts of things, they give you this impression of what it is like to succeed. okay? You see all these fitness influencers, they go into the gym, they're crushing their workout, they're doing all these things, and you think, it just makes it just this huge thing, you know? And one of the first things I do with a lot of my clients, I mean, the fact that they've come to me means they've already overcome that first step, okay? So it's so important to grab them and run with them. But that first challenge, that first goal can just be come into the gym once a week, yeah? Doesn't even have to be for the full hour. Just come do 10 minutes, you know, and just build on from that. Try and, you know, create this routine, create this habit, because a lot of the research shows that all you need for them to get the mental health benefits from exercise is 10 minutes of moderate intensity exercise.
Yeah.
Doesn't have to be high intensity, doesn't have to be, you know, 10 to 30 minutes gives you just as much benefit in terms of your mental health as 30 minutes to an hour. So just getting that first 10 minutes in gives you all the mental health benefits you need. And then obviously for fitness-based goals, you know, actually I want to get better at doing this. Obviously you need to spend more time on it. But just to get the mental health benefits, 10 minutes is all it takes. And those benefits last for 24 hours. So, yeah.
Yeah, and just to add to that, I compare a lot the gym to therapy with my clients in the sense of when clients have really high expectations or goals or are striving towards perfectionism, I say it's like going to the gym. You don't just go in and pick up the heaviest weight. You have to consistently and patiently and almost with a lot of discipline come to therapy, go to the gym and see that progress and enjoy it. Because a lot of people want to get to the goal and then as soon as they've achieved that, there's another one that they go towards. So I really focus on how clients can enjoy the process and actually be in their life instead of constantly thinking about the next thing that they can work towards.
Yeah.
Absolutely. Dr. Robert, one symptom that often comes up in consultations is fear of failure. And that obviously fits in with what we're talking about today. And when we're suffering from difficulties with our mental health, we quite often do get these thought distortions. Is this something which you see in your clinical practice a lot? And how do you go around approaching that?
Yeah, really good question. I think absolutely. I think based on what both Steve and Rebecca have said, you know, people are often, if they have a sort of A-type personality and are, you know, have these unrelenting high standards about what they want to achieve, anything less than that is seen as failure. But I think let's take that term failure and think about it. You fail every now and again, good. Good, right? It is a natural part of being a human. It is part of the human condition. We sometimes talk about the idea of failing forward because it's only when you fail forward and learn from that experience that you can think, what do I need to do differently next time? Now, to ask yourself that question, what do I need to do differently next time, and own the error or own the failure, you need to have something we call ego strength, which means actually I'm quite resilient, I'm quite robust, I understand that it's normal to fail every now and again, and to be able to integrate that experience. Now, particularly when people have compromised mental health, depression, anxiety, that is very difficult. And so any failure is seen as 100%, which is where cognitive distortions come in. So a cognitive distortion, our brain does this amazing thing that when we're sort of stressed or we're anxious or burnt out, our thinking narrows. So usually what we like to do is zoom up and sort of look at different situations, multiple perspectives, what's going on. When our thinking narrows, this is when we're in the territory of cognitive distortions. And I would say both in the sort of fitness space, but also in the therapy space, a common one is this what we call black or white thinking. So I'm either a success and I'm nailing my fitness goals, or I'm an objective failure, right? This sort of very black and white thinking. I think another very common one that we see is this idea of labeling. So where I label myself as a particular person. So I'm just not a 5 a.m. person. I'm never going to be a runner, okay? I'm never going to be a cyclist. I'm never going to be a cyclist. But, you know, like... but where we label ourselves, and what this does is it cements the narrative inside our minds and becomes what we call a self-fulfilling prophecy. So if I'm telling myself I'm not a 5 a.m. person, guess what? I'm very unlikely to wake up and go for that cycle ride at 5 a.m. So labeling is another very common one. I think, again, particularly with people with perfectionistic tendencies, this idea of catastrophizing, which is another cognitive error or thinking distortion. So because I only came in and did 10 minutes, it's the worst thing and everybody's laughing at me and that guy over there was looking at me and all funny. And this sort of catastrophizing a single event, and often then drawing inferences about future patterns about that. So because I had a bad experience and I was only here 10 minutes, that means I can never go to the gym again, right? So this sort of overgeneralization. I would, for anybody watching this, cognitive distortions, we all engage with them, even those of us that are in the profession. They are a natural part of human experience, but our goal is, right, how do I calm my central nervous system? And then how do I sort of rise up like a helicopter to get a 360, a more balanced view of what has just happened?
Yeah, it's interesting you're saying about calming the nervous system. Rebecca, I was thinking about, we talk about these small daily rituals. It's a phrase that's quite popular, and it's used a lot at the moment in terms of slowing down our nervous system. What role do you think these have, and how do you think it is a useful way to start applying these to our daily lives?
I think they're essential. I think they're number one in being able to support with mental health and setting goals, because if your nervous system is not regulated, it's really hard to move out of survival and into a place of thriving and achievement and success and movement. Often when we feel dysregulated, we kind of get locked in these survival states of freezing, of shutting down, withdrawing, and that makes it really hard to work towards our goals. So a big part of working through goal setting is also looking at the fundamental needs of, are you sleeping enough? Do you have a good sleep hygiene schedule? What's your morning routine like? And often clients will resist against that because it feels so simple. It's like, well, this doesn't feel like therapy, but it's only once we can regulate your nervous system that you will be able to think about, okay, how can I move forward? The brain always asks, am I safe? Am I loved? And what can I learn? In that order. So until we feel safe enough in our body and we work through some of this dysregulation, then it's really hard to think about those steps. So I invite clients to think about creating a really manageable morning routine. Can you get 5 minutes of sunlight on your face? Can you go for a walk, or can you move your body for 30 minutes? Are you eating a breakfast within 30 minutes of waking? Can you have coffee on a full stomach instead of an empty stomach? It's really small adjustments. Throughout the working day, can you look at moments of pausing so you can connect with what you're grateful for? Where are your glimmers? Where are the things in your day that have created a sense of joy, a sense of meaning, a sense of purpose? At the end of your day, can you create a digital sunset where you maybe take 30 minutes before bedtime and you engage in reading or a bath or something relaxing? And when I set clients this challenge to do it, you will naturally see cognitive distortions decrease, you'll notice mindset changes, you'll notice the narrative that clients say to themselves about who they are changes. So it's also really helpful for me to set goals for clients in the therapeutic process so that I can also reflect with them and look at that progress and that measurement. So it is really small steps, but they make a huge difference.
And I think just sort of pulling together what you're saying, Rebecca, cognitive distortions, as we've said, are so much more likely when the nervous system is dysregulated. If you are having consistently 5 hours of sleep per night, your nervous system is going to be 30% more reactive, regardless of what you're doing in therapy, right? It just is going to be 30% more reactive. And like you say, clients often get quite frustrated. Why do we have to start here? Because this is the foundation, right? This stuff is the foundation. Yeah.
It's funny, I think, all of our professions, sleep, it all boils down to sleep often.
Yeah. Sleep is king. Sleep is king.
I'm sure we all see people burn out and stress, and I completely agree. That conversation about sleep, oh yeah, I'm sleeping fine. Oh no, it's fine. No, I don't use my phone at night. And then you actually go into it, and they're up in the night and they're checking their phone because they can't sleep. It's disrupted sleep, even if they're in bed for 9 hours. And I do think it has such a huge role.
And this is the thing, I mean, we're all looking for this magical solution to trying to get to where we want to be, but a lot of the times it's the things that we don't have to pay for, it's the things we don't have to put any effort into. Sleep.
Yeah.
get more sleep, you know, and that's the main thing. And I understand a lot of people, because we're so busy in Dubai all the time, traffic's a nightmare, we have really busy work schedules, all these things. So by the time we actually get home, we want to have free time. And we do that at the expense of actually getting enough sleep. So we're awake until midnight, 1, 2 in the morning, because we're thinking, oh, finally I get to have me time. But you're robbing yourself of good mental health, of having a healthy lifestyle by not getting enough sleep. You know, get more sleep. And I mean, as you were saying, it's these little things, it's these little challenges. Again, coming back to the 10 minutes of exercise, people look at that and think, yeah, but it's only 10 minutes. What's that going to do for me? It's like, yeah, but it's 10 minutes more than you did before. You know, it's going for that 10-minute walk. You know, it makes a huge difference. It doesn't have to be an all or nothing approach. Okay, little steps to make bigger changes. It snowballs.
But this is where I think skilled practitioners, therapists, psychologists, psychiatrists, personal trainers, coaches, this is where you've really got to watch the narrative of the client that you are working with, coaching, doing therapy with, treating. Because, no, I can't go to bed, right? I can't go to bed at 11, right? I can't. Okay. Let's unpack that a bit. Let's try and do some motivational interviewing. Explain to me why, because that in itself could be a cognitive distortion, right? And we often talk about, you know, I can't do something, it is I am not prioritizing something. Because, you know, we hear this a lot, traffic's bad, I'm so busy, but you've still got time to be on social media for like 2.5 hours, right? So, you know, we really need to use what we would call empathic confrontation, right? Let's pull apart the narrative that you've constructed in your head that is reducing your effectiveness at meeting the goals that you say you want to meet. Let's really unpack that.
Yeah, absolutely. Well, I've really enjoyed talking today. It's been really, really interesting hearing how from each perspective and all these professions, how the role of goals in our mental well-being. So thank you very much.